everyone, it's Dr. Gina or Dr. Gina Jefferson, Professor of Otolaryngology, Head Neck Surgery. And today I have with me Dr. Sandra Stinnett. We're going to have a real conversation about family planning. I have interest in trying to explore really what people consider, particularly women, when they're trying to family plan as an otolaryngology resident, particularly because my own residents are faced with this challenge year in and year out. So can you give us kind of an idea when you actually began your family? Was it medical school, residency, or after?
So all very important and great questions. And so I think the most important thing and the best thing that could have ever happened to me was that I had support. Even though I was the first resident to have a child in residency in a long time, I had a lot of support from my attendings and from my chief residents to kind of guide me along the way. They didn't have kids, but they were able to say, okay, this is when you should consider because this block's a little bit easier, or we could, you know, you get otology twice. So maybe the second time you could probably get your maternity leave at that time and it won't impact you for graduation too much. So seeking that direction was clutch. I had my first child, 4th year.
Okay. Yeah, I think it's key as a resident, if you, even if it's unexpected or planned pregnancy, to really kind of let your program director know early so they can make plans for the rotations without really interrupting the others. So can you give us some insight as to some of the creative ways that you actually incorporated good study habits while juggling the new babe as a resident?
I would read to him. I would read Cummings. It was the neurootology chapter. It was like words like cholesteatoma. But there were other things that I did, like apps that read the text back to you, search like text to audio apps. There's a bunch of apps that you can use to just read any journal article to you or any chapter that you download from PDF onto your phone. Waking up at like ungodly hours, 3:30, and continuing that, because we do that in residency anyway, but 3:30, 4 o'clock, that's your time and your time to be alone and get things done, and self-grace when it doesn't work out, but you know, you want to be as structured as you can.
One final question. You mentioned earlier that you did feel the support of your co-faculty, of your faculty and your co-residents. Did you feel it was universal? Like, I feel we as a faculty where I am are really generous and supportive, but obviously it's a concern amongst residents everywhere.
Right. So, you know, I think that it's not something that could be generalized. And granted, the majority of my program was supportive. But there are some residents that thought that maternity leave was a vacation, and it was far from that. But I feel like residency kind of trains you to be a surgeon mom in a way, because you don't know what it's like not to be pregnant in residency. You just know what it is to be a resident.
Any last pointers you want to give residents considering starting their family?
So I think that a lot of us have apprehension once you do it and you give it your all, instead of worrying about, you know, what are they going to say? Just do it and just give it your all.
If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Jo on Instagram, YouTube, and Twitter.